Hello, good morning or good afternoon, depending on where you are. My name is Uche Akabande, Director of the National Resource Center on Nutrition and Aging. The center is hosted here at Meals on Wheels America through a cooperative agreement with the Administration for Community Living. Welcome to today's virtual webinar event titled Emerging Learning about Nutrition Status, COVID-19, and Nutrition Education in Older Adults. We're excited that you are joining us today. During today's webinar, we will be taking stock of new learning and information around the COVID-19 public health emergency and the nutrition status of older adults. During this virtual webinar, you'll also gain insights about how senior nutrition professionals can leverage this emerging information to craft nutrition education messages and resources for older adults and other stakeholders that they serve. Before we get started, I'd love to introduce you to our speakers today. So without further ado, welcome Dr. Sarah Booth and Susan Sappel-Schreier. Sarah Booth is the director of the Jean Mayer USDA Human Nutrition Research Center on Aging, as well as a senior scientist and director of the Human Nutrition Research Center on Aging's Vitamin K Laboratory. She's also a professor in the Biochemical and Molecular Nutrition program at the Friedman School at Tufts University. Welcome, Sarah. We're also joined today by Susan Sappel-Schreier, who is a registered dietitian and certified gerontologist and serves as an associate professor in the Department of Family and Preventative Medicine and an adjunct associate professor in the Division of Nutrition at the University of Utah. Susan provides both general nutrition services and geriatric nutrition as part of her work at the senior clinic at the Sugar House Health Center. And she's an active member of the Academy for Nutrition and Dietetics and the Society of Teachers of Family Medicine. Welcome to you both. I'd like to turn things over to our first speaker. So Sarah, please do, I think there is an introduction slide here before we get started. I wanted to set the stage a little bit for those attending today's webinar. This summer, we fielded a technical assistance and training needs evaluation to determine the learning needs of the senior nutrition program staff around the country. There is a website on this screen. You're more than welcome to surf on over to the National Resource Center website to view the findings from this work. We gathered a lot of information, and one of the things we learned was that the network had a great interest in delving deeper into what do we know about the nutrition status of older adults, and particularly that question is so relevant during this season of the COVID-19 pandemic. So we set out to have some virtual learning events this fall to delve into some of the key areas of learning need. Our first webinar focused on doing a landscape assessment to determine the evolving business needs of senior nutrition programs as our business areas are evolving during this time. Our second webinar that we held just earlier this week looked at serving in culturally inclusive ways older adults in the Senior Nutrition Program Network. And our final webinar is today's webinar, where we're really looking at nutrition status of older adults, what are we learning during this time of COVID, and how can we use those learnings to inform our work around nutrition education. So to borrow a phrase from Jeopardy, the answer ultimately that we're here to give to you today is meeting the training needs, understanding more about the nutrition status of older adults. And our question is, what does COVID-19 have to do with it? And throughout today's presentation, you'll be able to provide, get some answers to this question. So let's find out. And Sarah, you are first up to tell us more. So take it away and thank you.
So thank you very, very much for inviting me today to speak to all of you who are on the ground administering meals and nutrition to older adults. On this topic of COVID-19, I would ask that as you listen to my talk, that you consider it as a research experiment in some ways. It's because it is highlighting what we do know, but it is also highlighting what we do not know and we have to be cautious about. Next slide, please. Nope, back. Yep, great. So I am sure that many of you are bombarded with this. These are headlines, these are pieces of advice. This is, in some cases, people on soapboxes telling us what to eat during COVID-19. There's a very captive audience, not only you as providers of nutrition, but also your clients. Older adults are scared and they want to take control of their lives, their health, to minimize the impact of this disease, COVID-19. And people are looking to popular press, the television, social media for advice on what they should eat. Next slide. So before we tackle the nutrition part of it, let's just talk about COVID-19. So COVID-19 is the illness that results from exposure to a virus, the virus being SARS-CoV-2. And what we are learning over the last year is that different people respond differently when exposed to the SARS-CoV-2 virus. And that is, the manifestation is, of course, the illness in COVID-19. So we are learning that people with certain health conditions, chronic diseases such as obesity and cardiovascular disease and diabetes and lung disease, they appear when they're exposed to the SARS-CoV-2, they appear to respond more poorly. They have more severe extent of the illness. That's a general, that's on average. That doesn't mean every person who is obese, every person with diabetes is going to have a more marked illness. It's on average. In addition, we know that people who are older, they also experience more rates of death. That's not to mean that not everybody has a story about a 95-year-old who has been exposed to the virus and they not only survive, but they have minimal symptoms, but overall, older people are more vulnerable to the effects of COVID-19. Next slide, please. We also now, as the data are accumulating, know that individuals' race and ethnicity can also play into one's risk of the symptoms. So as the data are being collected, and unfortunately, as more and more cases are measured across the country, we now know that Blacks and Indigenous people in the United States experience much higher death tolls than individuals who are white and or Asian. Now, these are the data as of November 10th. I just want you to understand that COVID-19 has completely shifted the paradigm of scientific research globally. This virus was first identified in December 2019. As of this morning, there were 77,125 research papers published on the topic. That is an unprecedented amount of research. It is not being subjected to the same peer review because we simply don't have the capacity to. So what I would urge all of you when you hear research findings is remember we're continually learning. So what we may have understood in May may be different now based on new information, and much of what we're going to talk about today will be updated in 2021. So lesson number one is, as the research accumulates, we will know more. Next slide, please. So this all plays into a concept of health span versus lifespan. As we age, Many factors contribute to how long we live. There's a lot of attention right now on drug targets that will extend our lifespan. Biologically, we're programmed to live for about 120 years, but the average lifespan, depending on the many factors in the US, is more late 70s, early 80s. So the other factor is people can live for a very long time, but they can be disabled due to chronic diseases. In contrast, other people can live a very healthy life and have a very short period of time of disability before death. And this is the really the underlying concept of geroscience, or the science of aging. And we know now that there are a lot of factors that play in. Genetics, our heritage, which we cannot change, our lifestyle, which we can, and our environment. So in a pandemic, you've got all these factors. What has that person been doing prior to this point in time in terms of exercise, their diet? Are they living in an environment where there are a lot of insults to the body? And then also layered on to our genetics. And these actually all collectively contribute to how we age and our response to disease. And the COVID-19 pandemic has really highlighted that individuals respond very differently to an insult such as a virus. And even among the older people, there is huge variation. Next slide, please. Now, part of that is our nutrition. And I'm going to preface the next few slides by saying that while we know some things about older adults, our knowledge base of older adults relative to other age groups such as children and younger adults, it's very limited. We have very limited data on what older adults actually eat, particularly in the community. So here is a slide that was generously provided by a member of the Department of Agriculture. And I'm going to orient you to this. The blue bars are men, the green bars are women. And so if you look across the x-axis, you're looking at food groups, fruits and vegetables, protein foods. I'm looking at the food groups on the left-hand side. And then the percent, the vertical bar, indicates what percentage of older adults meet the recommendations in the dietary guidelines. So men, about half of all men, meet the dietary guidelines for protein, whereas women, only about 30% do. Fruits and vegetables, only about 14% of older men meet the dietary guidelines. The flip is, if you go to the bars on the right, the foods that we're really encouraged to avoid or limit through the dietary guidelines, such as added sugars, sodium, saturated fats. You know, we're among older adults, about half of older adults are actually not meeting the recommendation to limit added sugars. So what this tells us is that older adults are not meeting the healthy food groups, but they're certainly being exposed to a lot of the nutrients or foods that we should be limiting. Next slide, please. Now, one of the big challenges that I personally believe that is underplayed in dietary guidance, because we really don't have a lot of data, but we have sufficient to know this, is that as we get older, we need less calories. I think we all know this personally, but let me orient you to this slide. So on the x-axis, on the horizontal line, we're going from age 20 right to 100. On the vertical, the y-axis, we're going from the calories required per day from 1,000 to 3,000. Now that dotted line, horizontal line, is 1,600 calories, which is the lowest calorie intake for menus that are provided through the dietary guidelines for Americans. And most meal planning is around an expectation of 2,000 calories a day. Now, when you look at these, the graphic, you've got blue, you've got green, and then there's a place where they overlap. Blue are men. Men in their 20s get to eat an awful lot without gaining weight. But even men, as they get older, their energy requirements have a very gradual decline, such that the men who may have required 3,000 when they were 20 are probably more around 2,500 as they get to the end of their first century of 100 years of age. Now let's look, but there are some men that actually, when they reach their 80s and 90s, don't even need 1,600 calories to maintain weight. Now, if you look at the women, half of the women, when they're about 100, do not need 1,600 calories to maintain weight. And there has been a real emphasis on making sure that that frail older person eats enough so they don't lose more body mass. But there's a flip side to this. The majority of older adults now are overweight, and we need to be taking that into account. It is also probably why many older adults leave a lot on their plates, because they simply don't have the appetite or the metabolic needs. The challenge with this is you have to pack a lot of micronutrients. You have to pack a lot of foods in a very small calorie requirement. So you have to get all those nutrients that you needed at 20, but you have to get them in less calories, which means that the foods have to be very nutrient dense. Next slide, please. Now let's shift to food insecurity. And the USDA, the Economic Research Service, does an outstanding job of tracking food insecurity. And there was a big spike in food insecurity after the economic crisis in 2008. And seniors definitely were not immune to this. And so what they have found is, though, that the majority of households that were insecure after the 2008 economic crisis, they have declined in terms of food insecurity. Older adults have stabilized, but they have not declined. And about 9% of seniors in the US are living in poverty. Next slide, please. And I suspect many of you know more about this than I do, but one of the reasons why we have not had more spikes, and again, we're talking pre-COVID here, is because the USDA and the HHS have some really outstanding programs to provide food for older adults. The SNAP program reaches about 4.7 million households with older adults. We have the Child and Adult Care Food Program, the Seniors Farmers Market Nutrition Program, and then the HHS supplies home-delivered meals. Pre-COVID in 2016, it was about 145.2 million meals delivered to over 850,000 older adults. And then we also had congregate meals. Some of you may be aware that the Government Accounting Office was mandated to evaluate federal nutritional programs for older adults in 2019. They did conclude that we know very little about what older adults actually need to eat, but they also found that many of the meals supported by the federal programs are typically higher in sodium and saturated fat, which we saw in the previous slide. And both the HHS and the USDA have been mandated to improve oversight of meal programs for older adults. Next slide, please. But then we had COVID. And as you all know, much better than I do, the demand for food has gone up, and the older adults have not been spared from this. And there, in a report by the area agencies on aging, there was a 98% of them reported an increase in demand for food, and they reported a transition from congregate meals to home delivered because, of course, one of the major public health strategies is social distancing. Now, what I find very interesting is 61% of the agencies reported working with non-contract community groups, and we're using non-traditional partners to deliver services such as restaurants. And to me, this indicates that we will be changing how food gets to older adults. Just like society will never be the same, we can take lessons for things that worked and leverage them moving forward. Next slide, please. So I know our speaker is going to talk about a little bit about this in her talk, but I just want to talk about immune response. Next slide, please. So one of the big challenges as people get older is not only do they require less food because they need less calories, we also experience a decline in our immune system. And in this slide, I want you to focus really on the black bar that goes up and then it curves down. Again, we have to consider when we look at the older adult, they are accumulation of all those exposures of genetics, lifestyle, environment over their entire lifespan. And so it's a snapshot in time of a history of that person. So as we mature from infant to child to adult to aging, we've been exposed to a lot of environmental insults, pollution, smoking perhaps. We've had our nutrition may have been good at some point, weak at others. And all these collectively affect our aging, our immune system. And this is in part why older adults, when exposed to the virus, are unable to respond as well, and they are sicker. It is why the flu shot this year has a different vaccine for people over 65 than under, because it recognizes that as we get older, our immune systems are not responding as well to fight off the infection, but also, next slide please, for the vaccine. And I think that it's we are all required to start really thinking very seriously about older adult nutrition, because with any luck, the first vaccine will have provisional approval by the end of the day. And nursing homes are a national priority, but how those older adults in nursing homes respond to the vaccine in part is dictated by their health, which in part is dictated by their nutrition. So it's not just exposure to the virus, it's their response to the vaccine to help us as we all collectively overcome this pandemic. Next slide, please. There is a lot of media attention on single supplements, vitamin D, zinc, vitamin C. There's some encouraging research emerging about the role of single nutrients on our ability to fight infection. I would say the strongest evidence is in zinc. The vitamin D data are very conflicting. And again, like I said at the beginning, this is very rapid research. So it has not been really subjected to the test of time yet. In my personal opinion, advocating single supplements at this point in time can be a little bit dangerous for the simple reason that many single supplements, if taken in too high doses, will interfere with existing health conditions and they will interfere with medications. And no older person should self-supplement on single supplements without consultation with their healthcare provider. And in this current pandemic, access to primary health care is very strained, and therefore I feel that we should be very cautious before we advocate single supplements. Unfortunately, the media is promoting a lot of these supplements, so we have to be very mindful because we could actually induce more illness than actually protect older adults from the viruses and in their response to the vaccine. Next slide, please. And again, as I said, vitamin D is getting a lot of publicity. I would tell you, as someone who does vitamin D research, the jury is out. I don't think that there is any conclusive evidence right now to increase vitamin D beyond the current recommendations of 800 international units. For the simple reason is that we now know that too high doses of vitamin D has long-term detrimental effect on bone. So my mother is 88, and my mother is of the philosophy, if something works, you just take more of it and it works better. And many of her friends are that way. And as a result, it could create more of a public health crisis because 1 in 2 women have osteoporotic fractures in our country. And therefore, we should not be promoting high doses of any nutrient that, if taken too much, would have a detrimental effect on bone health. Next slide. Now, there are growing evidence that fruits and vegetables collectively will improve your immune function. Fruits and vegetables are also recommended in the dietary guidelines for Americans because if there's any food group that is consistently associated with health, it's fruits and vegetables. As I showed you earlier, the majority of older men do not eat the sufficient numbers of fruits and vegetables, nor do older women, although older women do tend to eat more than men. So this is a food group that has no downside, but the challenge is how to get those to the individuals. Next slide, please. And our center, I'm very proud of this. We worked with the AARP Foundation a number of years ago, and we had translated My Plate for older adults. And I have another message for you. So we in the research community tend to be quite purist. And we see fruits and vegetables and we say, you know, you've got to have fresh fruits and vegetables and you got to eat this and you got to eat that. And I think particularly now, we need to step back and be practical. So I talk to my mom a lot. She lives in another country. She lives in Canada, and they have very strict rules about 88-year-olds going to the supermarket. And, you know, my mother was saying, the problem is, Sarah, for the first time in my life, believe it or not, my mother is very, very good on Zoom and Amazon. She's got her Amazon account, etc. But she said, the problem is I'm having to order my food for the first time online. And I hate what they send me with the fresh fruits and vegetables. I'm not there. I can't pick them. I can't choose them. And the quality is terrible. It's not what it used to be. And so I said, you know, Mom, what you can do is you can get some frozen fruits and vegetables. You can make your soups. You don't need fresh vegetables because the nutrient content in frozen vegetables, as long as they're not the ones that with added sodium, in some cases they actually have more micronutrients than the fresh ones because they're handled less. So I would really advocate that when you take these recommendations generated by researchers with the best of intention, adapt them to the circumstances. It's more important that people get fruits and vegetables than fresh fruits and vegetables. if people don't have access to foods, then what you have to do is adapt, and it's okay. And I think we've got to step away from making people feel guilty if they're not eating the foods in the media. It's what's realistic is much better than trying to strive for the ideal, particularly during a pandemic. And I think the most important thing is to encourage people to have fun with their food. Next slide, please. And I think that during all of this, when there's guidance, when people are feeling some people are feeling almost shame when they're being told that because they have certain chronic diseases, that they're at increased risk of COVID-19. I think we always have to remember that food is not just for nutrients. It is a very important part of our society. Yes, we can't get together right now, and yes, we have to eat and we have to have our masks, but soon we will be out of this, and we should never lose the joy of eating. Next slide, please. So I want to end my talk with a question to you. I am very fortunate and very privileged to run a research institute with 14 floors of very talented research scientists. We need input from the people who are actually supporting older adults, and what are the questions that we should be looking at to help you in your efforts to promote healthy aging through nutrition. And with that, I think that I'd like to thank you for for listening to me, and I'm going to hand it over to Uchi on how she would like to proceed next. Thank you again.
Sure, wonderful. And thank you so much, Sarah, for a great presentation. And so for those looking for contact information to send any questions that you might have that you'd like to write to our lovely speaker, please do leverage this email address on your screen. However, right now we have a few minutes, and I'd love to hear from the audience today. You know, if you had it to dictate the work of nutrition scientists, such as those working at Tufts, as was mentioned, what would you tell them? Or what would you ask of them to say, hey, nutrition scientists, this is a real concrete way that you can use to support us who are out in the field, providing support to the older adults in our communities to promote healthy aging through nutrition. We welcome you to type your answers into the chat box, and I'd love to lift some of these up to Sarah. That way we can have a conversation about what are the needs out there and what are the best places, best ways for our science community to provide that support. Perhaps it's greater insight into what motivates older adults in terms of taking care of their health and particularly paying attention to their nutritional health. What are the ways that we can understand what drives folks so that we can provide the resources and insights that they need? Could it be other ways that you want to know about how older adults manage their health, or what kinds of nutrition insights that they need? We welcome your conversation today through the chat box. So please do, again, let us know, respond to that chat question here. How can researchers support your efforts to promote healthy aging through nutrition? Welcome hearing your comments now, and we'll see them as they come in. Sarah, we had one message to you from a person who had to leave the presentation just to let us know that it was fantastic and they have to sign off, but they really can't wait to hear and listen to the archived presentation once we post it on the National Resource Center website. So that's a shout out from the audience to you. So thank you.
Thank you.
Well, while folks are gathering their thoughts on how much different ways to promote or to encourage our nutrition scientists to support our practice-based community of nutrition service providers, perhaps we can then transition to our next speaker. As your comments come into the chat box, I'll be sure to keep them so that we can circle back with Sarah as you're formulating your thoughts about your laundry list of recommendations that you'd like to offer. Oh, and before we do that, I just want to offer this one nugget to Sarah before, because I think this will be interesting for you too, Susan. But for Sarah now, I'd like to say one person attending the webinar notes that working in Florida with some of the oldest older adults by average age, they're convinced that meat is the only way. This particular person struggles to get them to eat vegetables and fruits. I guess their question for nutrition scientists is, what's the secret to convince them to eat less meat? And how do we combat competing messages in the marketplace that say, you know, beef or bust? Or how do we work with that sort of conundrum?
Yeah. So as I am not a dietitian, I'm going to defer to others about specific messages, but just this is one area that I would just alert you to that's an emerging area of research. So there's a lot of controversy about protein, and as in all things nutrition, the individuals who feel they need more protein are already eating more than enough protein. And it's usually the people who are not getting enough protein who are not the ones seeking out more sources. And one of the big challenges is we are learning more and more that animal food sources such as beef and other foods contribute to the acid content of our blood. And as we get older, our kidneys don't work as well, normalizing the pH. And what we're learning now is a lot of those people who have a lot of protein in their diet, particularly as they get older, it's having a detrimental effect on their bone. Now, I'm biased because I do bone research, but to me, bone health and muscle health are some of the biggest challenges of older adults. Because if you are not have the structural support and the flexibility for independent living, your disabilities increase incrementally. So if people, and that is something that people are very sensitive about. So if you're trying to shift people away from some of these sources, let them know that if they're eating too much beef, then what they're doing is they're changing the whole equilibrium in their body, and it will have detrimental effects on their bone. And nobody wants a hip fracture. So that would just be one. That's one thing. The other thing is the food industry has responded to the growing concern about the cost to the environment for producing beef. And I think there is a role for beef. I'm not anti-beef, but I think that beef every day is very detrimental to the environment. And the food industry now has developed so many plant-based meat-like products that it is pretty easy to get the sensation and the mouthfeel of the beef without eating the beef. So I would encourage people, all of you, to start exploring with people these plant-based products, because I think the food industry has to be commended for hearing the concerns and responding. Thank you.
Thank you, Sarah. I think there's one clarifying question that's just popped up, and it is whether the conversation is just limited to beef in those aspects that you mentioned, or meat as a food group as a whole.
It's actually not just beef. So it's a number of foods. It's the foods that we're all told to really limit. It's meat, all meats. It's also high intakes of grains. And fruits and vegetables are the ones that actually ameliorate a lot of these effects. So my apologies if that was confusing. It's not limited to red meat, it's all meat.
Wonderful, thank you, thank you. And the question asker thanks you as well for your clarification. Very interesting perspectives, and I hope useful to share. I'm going to post a resource in the chat for those who are seeking to have more insights in terms of some of the culinary aspects for how to provide healthful meals to the seniors that they serve. But as I do that, I will thank Sarah for your comments and transition to Susan's presentation, where she'll be talking to us a little bit about the nutrition education aspects of this particular season that we're in. So Susan, over to you.
Thank you. So glad to be with all of you today. I'm going to get the wonderful opportunity to tell you about some grant funding that I have that has led to reassessing nutrition education that we are providing as part of that grant, and provide you some in-depth detail about the education material that we've developed. Next slide, please. So this grant is actually a grant that's funded by the Administration for Community Living, ACL, and it's actually a second in a series of grants that we've had. Our first grant was a pilot study looking at the same issues of malnutrition during transitions of care, and we were fortunate enough to receive a second grant so we could continue this investigation. So I'd like to start out by giving you some background on what we're doing so that you have a better idea of why we did what we did with our nutrition education material. As I mentioned, the grant is funded by ACL, and I'm sure you're pretty familiar with the stats that I have listed in this area under background. 1 in 2 older adults are at risk for malnourished. 20 to 50% of older adults are at risk for malnutrition. Or are malnourished on hospital admission. That I think is really important because to me they're coming and knocking on the hospital door already compromised, and there's a real need to be assessing that. That figure of 20 to 50% varies, but that's kind of one of the common percentages that are out there. And lastly, of these folks that make it to the hospital that are malnourished, they have a 50% higher rate of rehospitalization. So our study, implementation of a collaborative malnutrition-focused transition of care and referral process, is investigating all of these aspects. We have some goals, project goals. We want to identify and track malnourished older adults from hospital to home, as our title hopefully communicates. And we have some primary and secondary goals in mind. We want to see how rehospitalization is impacted by our work, and also secondarily look at quality of life, functionality, nutritional status, mental health, and coordination of services. Well, as you might imagine, it takes a village to be able to do something like this. And during our pilot study, we started connecting with our research partners across the different levels of transition of care. And we're able to maintain those relationships and enhance them with the current project. So let me just highlight what some of our partners. First, at the University of Utah, we have access to hospital discharge data. And this is through a collaborative, actually. It's called the University of Utah Post-Acute Care Collaboration. Excellent group of people. They're connecting the hospital with community agencies, basically, in this case, home health agencies and long-term care. And then, again, we have very, very fortunate to be working with 4 area agencies on aging in the area. That is their Meals on Wheels program and senior services. So we're trying to, again, follow them home and see how we can tap into their care when they're at home. The last point I have here is home health agencies, and that's just a reminder to let me note that as part of the PAC, again, that Post-Acute Care Collaborative, there are 2 home health agencies that have a very significant presence in the area that we're doing our research regionally, and we have partnered specifically with them, but also have access to the other PAC members. Next slide, please. So that title was rather long, and so when we refer to our project, we just say Malnutrition and Transitions of Care. So who qualifies? Obviously, older adults, age 60 and older, recently hospital discharged, receiving or willing to receive Meals on Wheels, and they have to be also willing to have us come to their homes and over a 6-month period, and we also do telehealth. Depending if they're intervention or control, they might intervention receives monthly home visitations, and everybody receives monthly telehealth. So when we do our home visitation, I have a team of RDNs, and what we do is comprehensive malnutrition assessment. And by that I mean we're looking at all aspects of health and nutrition. So we look at the biological, the psychological, and the social. In addition to that, we do the nutrition-focused physical exam, and for the RDNs in the audience, I'm sure you're familiar with that. And then after we, collect this information, just as you would in a clinical setting, we tailor a nutrition care plan to that particular participant. And again, it could be from any, biologically, psychologically, social, and we have a fair number of resources that we can connect. And I should say that working with the area agencies on aging, they're fantastic as far as helping us with resources when needed. Next slide, please. So we had everything in order. We were really quite pleased. Life was going well, and then there was COVID. And, everybody had to step back, right? And we had to construct the situation. And we had to think about how we're going to respond. And all these terms here, I'm sure you're very familiar with. The surges, the quarantines, the isolation, working from home, politics, high-risk population, of course, working with older adults that have recently been discharged from the hospital, pretty frail. So definitely high risk. And then just a weaving of fear and confusion. So I think we all kind of came to a halt and had to start thinking, okay, how are we going to proceed with this? From an institutional standpoint, all research at the University of Utah was suspended. It was put on hold. And what that meant, and again, this is in the initial stages of March-ish, no, we could not see our client patients, directly. And so, boy, that's a fly in the ointment, if it, because that's really one of the key parts of what we're doing. So we quickly pivoted, and we resubmitted a temporary IRB, and that's the Institutional Review Board. And that's the organization within our university and across the nation, of course, that approves research. So we put in a temporary request to do telehealth only. So we had to step back and redo our assessment a bit and rethink that. Along with that, I was requested by our Vice President of Research to put together a safety protocol for the field work, is what it's called in our neck of the woods. And that was a fascinating experience. I was delving into CDC, CMS, the National Home Health Association, and of course our university policies and procedures to kind of put together a protocol that would be applicable in the home setting. And I will note that our protocol was accepted by the Vice President of Research and is now the template for the whole university. I feel like I know a lot more about PPE than I ever did in my life. Okay, next slide, please. Okay, so we kind of took care of home. We did the institution. We also, worked with our AAAs, the area, the aging services, in our state. And, but then we needed, needed to start addressing our partners because, of course, we definitely needed to maintain communication with them. But how do we do that? we're just sitting back and going, whoa, we're not getting referrals because everybody's on hold. What do we do here? And we definitely want to be, we don't want to have, the out of sight, out of mind kind of thinking. And we also had to consider strategic pauses that everyone was having to deal with, depending on their situation. And we needed to be attuned to that so that, there was no pressure from us. We had to be cautious in that regard. We also noted that we wanted to address all aspects of health and nutrition however we could, and that's that holistic approach that I mentioned earlier in our assessment. And mostly we wanted just to demonstrate concern and eagerness to assist all persons connected to the project. That means, family members, caregivers, who, in addition to our participants and the nurses and AAA intake people, all those folks. Okay, next slide, please. So, kind of sum up that little section. I'm pleased to say we are still here. And what we did is, like is promoted in the airline safety regs, is that we put our mask on first. That is the institution and the Utah State Aging and Adult Services. And we got our house in order. And then we were able to then care for the folks that are family in this respect, our partners. And at this point, I'm thinking, wow, we're just really improvising. We are just seat of the pants pivoting. And I just want to toss out this definition right now because I think it sets the stage for the rest of our talk in a way. So improv, the activity of making or doing something not planned beforehand using whatever you can be found. It kind of sounds like making a casserole. You're just putting together what you've got in the refrigerator and in your pantry, and you're creating marvelous food. Next slide, please. So I had to think back a little bit about this improv. It was very interesting to me, and I realized that at the Meals on Wheels conference in 2019, which doesn't it feel a long time ago, there was actually a session on improv. It was a breakfast session. It was the session was conducted by the Second City Works, which is their professional organizational group, and I found it really fascinating. But at the same time, I have to be honest and say, I was also wanting my cup of coffee and my breakfast and the like. But I picked up some things. And from the session description, there are some things that really now stand true with me. First, this is one of the statements. Improvisational methods inspire the mindset and behavior that leads to rapid innovation and incomparable content. These methods can drive personal growth and organizational improvement. Correct. And then the last sentence of the description was, this technique creates confidence to take on the network's biggest challenges and most promising opportunities. Well, we didn't know that COVID was coming and that we were going to have this opportunity. Next slide, please. So we fast forward and we're in the midst of COVID, and I'm still kind of looking at this improv stuff. And I come across the concept of applied improvisation. And I start incorporating it more into my mindset. Next slide, please. So here's some concepts that I think, ring true to me. The first one is adopting an improvisational mindset means intentionally choosing to accept everything as an offer, even if they're curveballs. Second one, we should treat these times as an offer and ask ourselves how we would construct the situation. And the last concept, that begins with shifting our attitudes from fighting the current constraints to taking inspiration from them. It just, you know, turned again my mindset around even more as I delved into this improvisation. I will tell you that I'm a novice, you know, and I'm not trying to sell any books, as you know, the book that I mentioned just a slide ago. But it is fascinating, and it does provide me some guidance. Next slide, please. So here we are. We're trying to figure out how we can stay in contact with our partners, and what can we do. You know, obviously, we can't do anything direct, but we want to maintain that positive relationship. And my one of my co-investigators, Amy Covington, and I, we just sat down and started brainstorming. He said, okay, well, yeah, we want to do health, and yeah, it should be holistic. And Amy came up with the term holistic health hacks. And so these are nutrition education, the materials, they're kind of blogs or fact sheets or tips, that kind of thing. And as we were thinking about which ones we wanted to develop, particularly as we went through those early months during COVID, we kind of fell back on the idea that, you know, we want to combat our good intentions, particularly as RDNs, and that we wanted to stay away from avoid. We wanted to make sure that every food fits, no judgment. And I'm going to add shaming. That seems to be a popular term that's being discussed these days, is particularly around COVID and compliance. And I think it could apply in this regard too. No shaming. And lastly, you know, we want to recognize and acknowledge how COVID has impacted our lives. And so with that, we set out to put together our holistic health hacks. And at this point, I want to share with you just briefly some of them that we developed. And we were emailing these to our partners and encouraging them to share with whomever might benefit from them. Okay, next slide, please. Oh, want to stop and ask some questions. Uche, do you want to take this?
Sure, absolutely. So thank you, Susan, for your presentation. You've really taken us along a journey here from your COVID experience and how ultimately through connecting with your partners, you're able to target the older adults who are ultimately served by your project and by these other senior nutrition program partners that you have. So we're wondering, among those who are in the audience today, about ways you've improvised this year. You may have experienced the same things. Services that you were providing in person that you no longer could, partners that you were engaging that you no longer could in the same ways as before. So please do let us know, in what ways have you improvised? Maybe there are some barriers that you have encountered in terms of doing nutrition ed in the ways that you've done in the past. What were those? Maybe there are new opportunities that have come your way. Thank you. One of you have said that you've taken your programming virtually. Excellent. So that's a new opportunity that came many of our ways this year to do different things. So please do let us know ways you've improvised in connecting with your partners, ways you've had to make changes, things you've run up against, particularly in an aspect of nutrition education, and things that have come your way that you found to leverage. So Susan, after we hear from you today, is going to talk a little bit about some of the opportunities that they found to engage with partners, continue to provide value, pivot nutrition education messages so they're relevant for the current COVID season. And she'll take you along her journey today. But wondering about your all's journey out in the network, if you can let us know ways in which you're improvising, as well as ways in which you might have encountered some barriers or new opportunities that have come your way. That virtual programming one, boy, yeah, that's been one for the books for sure. That is the opportunity du jour, but that brings some barriers too, as well. As that. We had another person chime in today to say they're also not able to offer in-person education, but their caterer now provides written nutrition education in newsletters, and they use that and distribute to participants. Great, thank you so much. Another person has let us know that they use handouts and mailings instead of discussions. So that's a great point. Thank you for sharing that. What's the way to be virtual? Sometimes virtual is digital, and sometimes virtual is a low-tech, good old-fashioned mailing as well. Different ways to do nutrition education virtually, digitally, and otherwise. So we appreciate your comments today. Well, please keep your thoughts coming, and Susan, I will let you know, turn things back over to you. We have folks saying technology has been great, but there have been barriers in terms of broadband access and equipment. So thank you for sharing those points, but carry on. Thank you.
Yeah, so just a comment about that. Most of our participants are older adults, homebound, not very technologically savvy. Not all. Some are, but we wanted to do as broad a reach as we possibly could, and that's why we fell back on emailing this to our partners and having them distribute it as they felt was appropriate. So good thoughts. So at this point, I just want to go through several of the holistic health hacks that we created and lead you through what we did, and hopefully we'll spirit you in some of your own adventures. So, and again, Amy Covington and I created these. We were a good team. Anyway, so we did supermarket survival, and we did 2 parts to this. Most of these are handouts are a one-page type of thing. And at the point that we were doing this, there was a lot of fear about, food shopping and the like. So I'm just taking a sentence or two from the actual hack. But in part 1, we're talking, it's addressing produce, and we said the U.S. Department of Agriculture is not aware of any reports of human illness surrounding COVID that can be transmitted by food or food packaging. So, putting people at ease, we can shop safely. Yes, we have certain things we need to be doing, but it's totally possible. And then the second part was basically saying, okay, now you can do it safely. Please enjoy. Food nourishes the mind, body, and soul. And then there were tips on shopping for produce. And so those were some of the first 2 that we did. Next slide, please. Some of our hacks actually turned into more blogs, to tell you the truth, and I think I was more the blogger than Amy. And I enjoyed it. So this first one was on comfort food therapy. And we were just trying to say, I'm okay, you're okay. I know we're isolated, but, we're going to make it through this, and please take advantage of your favorite comfort food. And in fact, I think I said somewhere in there to embrace your inner comfort food frame of mind, and just giving people permission to have that tuna noodle casserole or whatever it is that they enjoy, if that will provide them comfort and help them, continue to be healthy during all these progression of the COVID pandemic. The next one is protein, and I'm glad we had that discussion earlier with Sarah. How much do we really need was the title of this one. There were 2 aspects to it. When I wrote this one, the meatpacking plants, the COVID positive rates were skyrocketing. Some plants were being shut down, at least for a while. And there was this oh my gosh, I'm not going to get the meat I need. And we wanted to basically let them know that there's multiple ways of getting adequate protein, and it's not just meat. And then we went into, recommendations and that type of thing. As far as protein supplements go, just protein and meat, one thing that I have found to be useful when I'm talking to older adults who have some drink that has 100 grams of protein in it and plus they're eating well, I just refresh their memory or tell them to begin with that, any added protein that you eat that is not needed, it's going to be used as energy, and it won't be laid down as muscle, and then that can influence your weight, and that usually resonates with them. Oh no, I don't want to gain weight. I just want to have enough protein. So this one I think has been pretty well received. Next slide, please. Amy took on weight management. She did flatten instead of the curve, your curve, and how to avoid the quarantine 15. Weight management, definitely an issue with a lot of our obese, malnourished older adults. And the flatten your curve had a fiber twist to it. And then the quarantine 15, just a lot of good points on how do you manage during these times to not over consume your calories and that type of thing. So 2 really fun health hacks. Next slide, please. Just put an egg on it. The whole idea behind that is that if you're you don't have the energy to cook, you don't want to cook, whatever it is, you can just go to the refrigerator and pull out some leftovers. And if it's something like a soup or a grain or veggies, just poach an egg and put it on there or cook it with it, or if you're making ham fried rice or something, and you can round out that meal as being adequate. So that was just giving them ideas on how to just put an egg on it. In the same light, we did simple meal ideas, breakfast, lunch, dinner, and snacks. This was actually a multiple handout. I'm giving you one example of what we put on there, a salmon wrap, but you can sub the salmon with tuna or beans or whatever, and the wrap, the idea is you can look in your refrigerator again and see what veggies you've got, and or yogurt or hummus or whatever, and make a wrap and have a nutritious meal. Then we did a meal planning tips for caregivers. Actually, Amy took this on. She did a wonderful job. It's very extensive. It's very supportive for the caregiver, so that they can have, meals prepped that their loved ones can mix and match and make meals and the like. So that was a really useful one. Next slide, please. Boost your immune system. Sarah talked about the immune system. We tapped into it. Also, encouraging people to look at what they're eating and how to stay as healthy as possible, and how the immune system is important in fighting illness, to include COVID, and looking at food sources. Another one we did was cabin fever. This one was more of a blog. Let's see, I wrote it in the spring. And I just was telling people, okay, get outside, get some fresh air, and while you're at it, find an old pot, put some potting soil in it and plant a tomato, or, go full bore and, plant a garden and reap the benefits of those fresh vegetables, herbs, whatever they decided to grow, and just being outside and how that can help you mentally. Okay, next one. Cooking for One really focused on the older adult and how to make balanced meals. We took a lot of the tips from the Academy of Nutrition and Dietetics for that one. Another one was hydration situation. We did that in the summer. Summers in Utah can be hot. We typically are over 100 degrees frequently, but this past year it was more than frequent. It was a very, very hot summer. So we thought, we better revisit hydration and put this together for them, just to promote adequate fluids. Okay, next one, please. Next slide. Okay, these are the last 2 examples I have. Simple pantry essentials. It was just, think about a pantry, and you don't have to have a physical pantry. What's on your shelves, and how can you put that together so that you can easily access it and create a balanced meal. So that was a fun one. And the last one I want to mention is eating your way to a good night's sleep. During COVID, sleep deprivation has been a common complaint, and we just wanted to highlight how nutrition can play a part in getting a good night's sleep. So with that, I've given you examples of what we did. Again, starting early on in COVID and kept sending these out as a means of staying in contact with our partners. And then, of course, we are now able to do our research, home visits, etc. And what we do now is we take these with us and give them to the clients, the participants, as we see fit in the interest they have, the participants. I also will say that it was very therapeutic. I will say for myself, and I believe Amy would concur, because we got to step back and go, oh yeah, I'm okay, you're okay, and we're going to make it through this, and we're going to have some good eating. Next slide, please. So I think we're back to some discussion questions. Uche, I can read it, or Uche, if you want to take it, whatever you'd like.
Sure. Thank you. And thank you so much for taking us through those different messages. And I hope others on the call today, like me, really appreciated just the different ways in which they spoke and speak still to the current time. Like Sarah was saying, this is a time of discovery for us in the nutrition area. There's much we are learning, and it is a grand experiment as we all navigate our way through this novel situation that's impacted the ways in which we do our work, the ways in which we connect with the seniors that we serve. I've loved so many of the messages you shared today, Susan, about the supermarket survival. Remember when that was a thing, when we weren't sure what that meant, going to the grocery store? We have greater insight now, thinking about ways in which the lockdown have changed the ways in which we eat. And the nutrition research is very clear that because we are home more and more, we are changing the ways that we interact with our food environment. Are we making different choices around comfort food? So I love the one that you shared there, Susan, as well. Are we snacking more? Are we having more perhaps high carbohydrate foods? Are we balancing our calories through the day? Are we eating in ways that we didn't? Do we have company at meal times? And same thing with our seniors, so that they're consuming as much as they might have in the past, or less so now if they're eating alone. So there's so much about COVID that impacts nutrition and how we interact with our nutrition environment, that tailoring those nutrition messages as ways to provide value-added communications to our partners like Susan had done, or just to that downstream senior that we're all targeted to serve. What are ways in which we can really think about the current environment, how it's impacting how we eat, and how we can message around that. So again, I turn this as an opportunity for you to share with us, those of you on the call, ways in which you might have pivoted your nutrition messaging during this time. So we know that technology are ways that folks are using to overcome barriers. We know folks are using handouts and mailings instead, but maybe there are some interesting ways your nutrition message has changed this year for the seniors that you serve. We'd love for you to be able to tell us some of these. Susan has provided some very interesting examples here today. Love the just put an egg on it. I have to say that is one that I am all about, Susan, so thank you. I feel like I have now permission to do that more. Excellent.
There's no shaming at all.
No, I needed more permission around eggs. I know that's not everyone's favorite food, but I am doing just that. So thank you for that. And maybe there are other simple messages that you've created. We'd love to hear that. This is your time to share with us, and we will in turn share with you ways that we're all working together in this novel time to make this work. We have one person on our call today who shared with us that they've started receiving fresh fruit and ready to eat veggie boxes from our local food bank. that we
Yeah.
distribute to their Meals on Wheels clients. They've started doing Facebook Live events as well. So way cool. Thank you for that. We pick a unique or interesting item from the box and do Facebook Live presentations and discussions around key nutrients, health benefits, how to prepare or eat these materials. And this person sharing with us lets us know that they've been fun and they've had a really great response. So thank you. That's what a fabulous idea. I love that, just to have an interactive, engaging, organic conversation around different ready-to-eat veggie boxes. And to your point, Sarah, to say, no shame. This is what we have available in this box. And we're going to talk about with this box what to do with it. So we're not stretching necessarily for past our comfort zone. We're saying within a particular parameter, this is what's on offer, and we're going to leverage this to provide nourishing meals for ourselves. So I love that. Thank you. That's an excellent idea. We'll have to follow up with you on that one, because that is a really cool way to do nutrition ed and connect and leverage technology to do that. So maybe you all have a neat way that you've been using this time to do nutrition education and pivot the COVID message for the days and times we are in. So I appreciate that. Do let us know. We'd love to hear from you. And I also wanted to let folks know, in case you're interested in some of the hacks that Susan talked about, that they're available in the webinar platform. So please look on the right-hand side of your screen in the handouts area. You can click on the handouts menu there, and you will see 2 of these handouts that Susan has so graciously made available. So again, you can have a look at the whole nutrition hack message and leverage some of that for your own use. These are RD and created, science-informed messages. I want to be sure to lift that up there, Susan, that these are dietitian approved. And so that's really important during this time to Sarah's presentation about the misinformation that can be out there around COVID and nutrition and all the messages that folks are being bombarded with. So having real science and nutrition expert informed information is so critical. So thank you for that. The 2 handouts are on boost your immune system and some menu planning tips for caregivers. So please pull those down and take advantage of those. Well, we would love for you to keep your nutrition education ideas coming to us through the chat box. Appreciate that. And with that, maybe we can press on with our presentation today. Okay, so we're at the question.
Yeah. There we are. I again would love to take questions that you have for me, share ideas. This is our time to do that and to connect. So just let us know.
Wonderful. And I think that your contact information is on the next slide for those who want to maybe reach out to you directly because they have specific questions for you, informed by the work that they're doing individually. So again, thank you for your insights that you shared with us. And thank you also to Amy, your partner in crime, as you have come up with these holistic health hacks, simple breakfast ideas, just put an egg on it, and other messages that can be really useful for folks as we think about COVID-19, how it impacts our nutrition status, how particularly it has been a challenge for older folks in terms of accessing good nutrition as well, and how we might provide messages that are mindful of what we know from the science, what we understand from nutrition professionals, to be able to help the older adults that we serve. So with that, next slide, please, if you will. We're again at the Q&A, and next slide after this. Fantastic. So where do we go from here? You've heard 2 excellent presentations. We hope that you may continue to interact with us. But before we go here, I realized there was a question that came in, and I want to be sure to be able to lift that up for our webinar today. Great. There was one additional question that came in, and so this is for either Sarah or Susan. This was a question about reducing, how to support older adults who are interested in reducing their consumption of different foods. So for one question was about plant-based alternatives to meat, but this one question comes in about the high sodium and saturated fat content of some of these products. So there's a bit of a push-pull there. We want to maybe help older adults understand that there are different alternatives to meat consumption, but we're also concerned about the nutrient profile of these alternatives. Do you have, Susan, Sarah, any thoughts and recommendations for folks navigating that push-pull?
I can comment on one thing that we see frequently, and because we do a little assessment when we do home visits of their, we'll say, kitchen, and if we find a lot of prepared meals, then we step back and talk about the fat content, the sodium, and the like, and the handout about simple meal preparation, healthy meal preparation, and the pantry. We can talk to them about how, you know, this can happen within, you can prepare this meal within minutes, maybe more than that, and you know, and you can have a more nutritious meal. Sarah brought up the idea of, you know, the frozen vegetables. Definitely push frozen vegetables and frozen fruit to have it in the freezer. It's, I guess we call it part of the pantry. So that's my thought there. Sarah, did you have anything you'd like to add?
Yeah.
Or?
So I think that push-pull dilemma that you're describing is exactly what the Government Accounting Office identified as a big problem with meals that are being provided. And I think we do have to acknowledge that our sensory perception declines with aging, and therefore there's more of a blunted taste perception. So sometimes people are striving for more instead of less, particularly if it's food that they're not finding particularly palatable. I think that with the new food labels, there's been a lot of emphasis on making it easier, particularly for older adults, to identify the sodium, the fat. And I think that, you know, while I absolutely agree with Susan, anytime people can make food as opposed to buy prepared food, the likelihood of encountering too much fat or sodium is reduced. I also think that there are a number of people who don't cook, and it's hard to change habits. And I think for those people, if they're going to buy prepared foods, I think the food industry is responding. I mean, there's a lot of low sodium, low fat options out there, low saturated fat options. And I think if people don't want to cook, the alternative is they need to better educate themselves where possible on the labels for the foods in the pantry. I love that analogy, Susan, in the pantry. And I think that so I'm a very strong advocate of giving people options. So that's what I would say. I think Susan's making great ideas, giving us great advice for those who are not prepared to cook. There are options out there, but they have to make the extra effort to read the labels.
Great, thank you. In that same vein, we really appreciate your comments. Another person had asked about how to leverage non-wheat-based pasta products to help limit intake of, you know, or try to provide more nutrient-dense options. I think this is reflecting on your comment and yours too, Susan and Sarah, about just that how to strive for nutrient density, right? Making every bite count. They're wondering if using pastas made from rice, lentils, other legumes might be a safe substitute. Is that a way to go? And I invite those of you on the call too to weigh in. These products are out there on the marketplace, but they do have different ways in which they hold up culinarily in terms of their use. And so what are your thoughts then, our speakers? Are using these pastas other ways to move towards greater nutrient dense offerings, do you think?
So can I just, I'll just answer from a researcher's perspective.
Sure.
You know, remember when everyone said we needed to eat brown bread as opposed to white bread? And there was
Yeah.
all these products that emerged on the market, and some really increased the grains and increased the fibers, and others were just the same as white bread, just a different color. And I think that is true for many, many of the products you're raising. So what I'm going to strongly advocate all of you on the call really become familiar with is the US Department of Agriculture has the most comprehensive nutrient content database for foods. And about 2 years ago, the USDA partnered with the food industry, and the food industry now submits the nutrient content of their food, their prepared products, to the Department of Agriculture. And there's something like 22,000 foods. It's probably much more now there. And what I would be advising all of you to do when you give guidance to older adults is, when these questions come up, go to the food database. And if Uchi would like, after this webinar, I'll send you the link, and so you can she can share it with all of you. It's better to go in real time, because every product is going to vary, and there's going to be some that are going to address the needs of fiber, and others that are just cost more, and they're, in terms of nutrition, not achieving more. And I think you just have to be facile with the database to see what the products are, and it'll help you get a better sense, I think, in your meal planning. Susan, I'd love to hear your thoughts.
I think about every food fits, and I also think about food preferences that I deal with, and what foods are, what foods can I suggest that I think the older adult would consider, at least in my area, and so you need to do a little teasing. We have a large Hispanic population, and so legumes are not foreign, and so not so much lentils, I guess, is another example. Well, maybe not lentils or some of the other grains, but if I can kind of reach out and talk about legumes. So understanding your client is really important, and encourage them. The other thing is that so many times there are family members who are bringing over dinners, just like Meals on Wheels. They've got Meals on Wheels for lunch, and then their family brings over dinner. When I'm talking to the family members, that's when I can say, hey, participant X, is really tired, is not so fond of rice. What might we substitute? What are you doing for your family? And try to introduce that in that way. So just getting to know your population and what they might respond to. And with the health hacks, males, divorced, single, widowed, whatever, of a certain generation typically aren't, active in the kitchen. And so if I can demonstrate to them how to, make one of those wraps, and in a short period of time, they'll consider it sometimes and sometimes not. And as Sarah said, then look to the food labels when you go to prepared foods, and critique that with them. Reviewing how to read the food label is extremely important. I find a lot of folks have difficulty with that.
Thank you, ladies, so much for your comments. I mean, there's a lot to unpack in terms of implementing these good suggestions, but I think we've come a long way today with your insights and suggestions around those comments. Be data informed, be informed by the practices and needs of your network, and leverage the times and what we're learning to tailor messages, using all the opportunities that COVID has brought to us to meet the needs of the older adults that you serve. So we thank you for joining us for today's conversation. I'm mindful that we are at the end time for today's webinar. We invite you to use the chat box link there to join us next week as we continue this conversation and talk a little bit more about some of these wonderful ideas that you shared with us today, and say how are we going to take these ideas forward as we close out this year and into the new year. So again, thank you, Susan. Thank you, Sharon, for your expertise and the time that you shared with us. We are so grateful, and we look forward to seeing everyone else on a future virtual learning event. For now, thank you all and have a great rest of your day.
Thank you. Bye-bye.
Thank you. Bye-bye.